I think there needs to be a level playing field. So whether there is more regulation for everyone or less regulation of the pharmaceutical industry, I believe there needs to be a level playing field in the sharing of information.
I mean, I agree. I am in favor of not more regulation, but less regulation for the pharmaceutical industry because we need that information. People have varying degrees of ability to understand or interpret it, and there needs to be some mechanism in place to be able to translate that information so that the average layperson could make a decision about, the effectiveness of it or compare one to another. But the more information, the better. People have the right to that information, and no matter where and who generates it, and that's critical, I think. We are being asked as consumers of healthcare to become more and more observant, more and more cost conscious, to ask questions, to examine our medical bills, and become more responsible consumers. We can't do that unless we have information. And so information on cost, information on comparative effectiveness between this drug and that drug, this one costs half as much, whatever, and it's just as effective. We need that information to be able to be cost-conscious consumers. I don't expect, to be honest with you, my doctor to know all this comparative effectiveness. But I do expect that it should be easy to find, number one, and that I can then go in and say to my doctor, here, take a look at this, let's talk about this. But it should be disseminated along with when you're looking up a treatment for a particular disease. That information should come up with all the other information about, symptoms and treatment and whatever else.